Many times in the treatment of shoulder problems, either those with or without surgery, stretching is required. Stiffness many times leads to the pain that you feel. I'm going to demonstrate my stretching exercises as I would like to see them performed. In the office, we will provide you with an outline of how the stretching exercises are performed. This stretching exercise outline pertains to the left shoulder, but there's also exercises that pertain to the right shoulder. They're identical, but the sheet that you received will be pertinent to the side that you need stretched. There are 4 exercises. I will demonstrate each of the 4 for you. The first exercise is the pendulum exercise. It's the simplest of the exercises because it requires no more than the back of a sturdy chair. I'm going to demonstrate the pendulum exercise for you. You'll perform this exercise twice daily for 2 minutes each time. It's a nice exercise to perform first as it loosens the shoulder. You will lean over approximately 90 degrees with your contralateral arm supported by the chair or table. The arm will dangle. You will use the help of your body to move the arm. You can go clockwise, counterclockwise, forward, back, left, and right. There's no right way or wrong way to perform it. You don't want to necessarily use the muscles of your shoulder, but to some extent you can use your body to move the shoulder throughout that arc of motion. The next exercise is one of 2 stick exercises. You will be provided with a stick. You'll piece the stick together. Many patients ask me why it's in 2 pieces. It makes the stick much easier to take during travel, as in this position it can fit easily into a carry-on piece of luggage. Once the stick is assembled, you will then perform the exercise. In this instance, as I stated previously, we're talking about the left shoulder. So it's important to understand that when you're doing these exercises, particularly in the post-operative period, the operated arm should just be taken through the range of motion by the unoperated arm, or the injured arm should be taken through a range of motion with the uninjured arm. If it feels like your injured or operated arm is doing work, then you may be performing the exercise improperly. In this instance, you will take the elbow of the injured arm, place it at your side, and focus on an external rotation movement. Again, my right arm in this instance, which is uninjured, is moving my injured left arm through the range of motion. In this instance, I would bring my arm out to the side where I feel stretching but not pain, hold it for a count of 5, and then bring it back to the starting position. Here I'll show you. The next exercise can be performed either with a stick, or sometimes I prefer a bath towel. I'll demonstrate it with a bath towel. This is an internal rotation exercise. Again, the left injured arm in this case will be taken through a range of motion by the uninjured right side. I'll take the towel out straight, place it behind my back so that the injured side now has a hold of it. I will then take my injured side and bring it through an arc of motion. Again, the right arm is providing the motion. It pulls the left arm behind my back, holds it for a count of 5 where I feel stretching but not pain, and then allows the arm to come back to the initial resting position. Here, I'll demonstrate it once more. Again, this can be performed either with the aid of a towel or the stick. The last exercise is the pulley exercise. You will have been provided with a pulley. Once you take it out of the package, you will unroll it. You will find two handle pieces and the pulley. There's a knot on the pulley end. You will take that knot, take it to a closet door or a room door that you do not regularly use, push the knot on the other side of the door and make sure it's secure. You will then sit down and ready yourself for this exercise. Again, my left arm for this example will be the injured arm. I many times liken the pulley exercise to a crane. In this instance, my uninjured right arm is the motor of the crane. Much like a crane on a job site, the load that is being taken to the top of the building does not help in the process. The motor provides all the power, and that's how you have to think of this exercise. So since my left arm is injured, I will first take and measure how much slack I should take out of this pulley system. Because this pulley does not take into consideration the height of your chair or the height of your door, we build in a little bit of slack into this system, and you may have to make some subtle adjustments the first time. What I generally tell my patients to do is to take their right arm, place it as high as one can. Now as I focus on my left arm, you'll see that when my arm is down here at a resting position, that I have this much slack built in. So I will move the handle, retie a simple knot, and now the handle is ready for use. I will then reach up to my starting position. Again, I want you to focus on the right arm in this example performing all of the work. So if my right arm is the motor of the crane, it will pull my left arm up. My left arm at this point in time is providing no effort. It is along for the ride. As I pull up to the point where I feel stretching but not pain, I will then hold it for a count of 5 and then let my right arm let the left injured arm down. If the left arm is helping as I bring the shoulder down, you may be putting undue pressure on your injured or previously torn rotator cuff. So it's important to make sure that the right arm in this example is providing all of the support. Once I perform this exercise between 10 and 15 times, the exercise will be complete. I will show you an example. The right arm is lifting the left arm up. When I get to this point, I feel stretching but not particularly pain. And then the right arm lets the left arm down. I hope that these stretching exercises will provide you benefit. Once again, many times tightness in the shoulder, either in a scenario where the shoulder has been injured or the shoulder has been operated on, many times is a major pain generator. As we improve your motion, we will improve your pain. Should you have further questions about these stretching exercises as I've described them, please give us a call at any time.